3 p.m. All right, that's right on time. Madam Clerk, all commissioners are present. I would remind you to silence all mobile devices. To help us with that today, remind all speakers to come, when you come to the podium, please press the button on the right. Be sure the red light comes on so that we can get a good recording of our meeting and hear you well, and also get a good recording on YouTube. Gentlemen, that brings us to item number 2, approval of agenda. We do need to add item number 6 for decision, for a timely decision on that today. An application for public school building repair and renovation funds. I would entertain a motion.
I'll make the motion, Mr. Chair.
Thank you, Mr. Vice Chair. All those in favor signify by the uplifted hand. 5-0. Thank you very much. Have a number of presentations today. The first one comes from the Board of Commissioners, recognition of Drone High School cheer team. And this will be presented later at our regular meeting. And unless there's some objection to that, we'll be recognizing them for their achievements. So without objection, this item will remain on the agenda. Item number 2 comes from Community Development, Friends of Fontaflora, presentation of grant match funds. This will be presented by Sarah Shabane, our planner, trail specialist. Afternoon, Sarah.
Good afternoon, Mr. Chairman, commissioners, fellow county colleagues, and members of the public. This is to present the Friends of Fauna Flora grant match. This has been an ongoing project since about 2021. This is our final piece of the puzzle to be able to submit our paperwork to DOT, and then they can start working on the project. So the Friends of Fauna Flora contributed to a large locally administered project grant, and they contributed about $150,000, as did our friends from Over Mountain Victory. So they will be coming at your regular meeting. They've already provided the check. This is more of a ceremonious moment to honor and recognize the contributions of everybody that's been working on this project. But as a reminder, this is to place about a 480-foot sidewalk over Canal Bridge, which will connect the existing portion of the Over Mountain Victory Trail in Lake James State Park to a future new section on the other side of Canal Bridge. And their executive director and board president will be coming to present that match to you. Thank you so much.
All right, thanks, Sarah. Any questions from Sarah on this item? All right, see here none. Without objection, this item will remain on the presentation agenda. Item number 3, also from Community Development, recognition of Janie Estrada, NCSSM's Assistant Director of Student Services, also presented by Sarah this afternoon.
Yeah, thank you again. The North Carolina School for Science and Math hosts a school-wide day of service each year on Martin Luther King Jr. Day. And they regularly provide volunteer opportunities for their students here at the Morganton campus throughout our community. Janie Estrada is the Assistant Director of Student Services, and she leads and coordinates this day. It's a really big effort throughout our community that she sends students all throughout Burke County. They volunteer with Friends of Valdez Rec, Animal Services. They volunteered with me at Fauna Flora County Park, as well as Lake James Environmental Association, and they do about 8 hours of volunteer service times about 300 students. So it's pretty impactful to our community. And all of this is done through Ms. Estrada and her coordination work. So this is to honor and recognize her for fostering that civic engagement and service among students through the North Carolina School for Science and Math.
All right, thank you, Sarah. Any questions for Sarah on this item? See you here now. Without objection, this item will remain on the agenda. Item number 4, Board of Commissioners proclamation declaring April 18th as Lineman Appreciation Day. And pleased to present that. This will be presentation declaring April 18th. And glad to see Robin Nicholson in the audience today. And I'm kind of assuming there's a couple of linemen you got with you, Robert. Good to see you guys with us. We'll be giving special recognition for you on the 18th. And any questions on this item?
I just want to say, as the father of a lineman, thank you guys for what you do. I see day in and day out how hard it is, especially when storms come. when everybody else is running away from the danger, you guys are running towards it, and we appreciate that. Our world doesn't exist without what you do, and I appreciate it.
Thank you, sir. Any other comments? Of course, I would be remiss not to say the same. As being associated with our electric cooperative, Rutherford EMC, and the region that we serve, we depend on our linemen and all of our line folks to take care of us. And thank you guys for being here. Thank you for what you do every day. Without objection, this item will remain on the presentation agenda. Item number 5 comes from Burke Recovery. Thank you. Recognition of 2026 NC1 Community in Recovery Adult and Youth Award winners. This will be presented by Tracy Hall with Burke Recovery. Thank you.
This is just a request to recognize the winners this year. We're very fortunate, both of them. The adult winner is coming from Burke County, and the youth winner is coming from Burke County. The North Carolina One Community and Recovery Conference is an annual event that's organized, and it focuses on bringing personal experiences of recovery from mental health and substance uses, and it also focuses on giving those youth a voice. So we will have a youth winner from Burke County and an adult winner from Burke County for the whole entire state. So.
Great. We'll be looking forward to that. Any questions for Tracy on this item? Seeing here none, this item will remain on the presentation agenda. Thank you very much for being here. Item number 6, Board of Commissioners recognition of Danny Scalise, our local health director, for his service to Burke County. We'll be recognizing Danny at that time. Any question on this item? Seeing here none, this item will remain on the presentation agenda. And lastly, recognition of our clerk, who will also be going into retirement, and we look forward to recognizing her more appropriately at that time. So thank you, Madam Clerk. Any questions, any hard questions?
Yeah, Mr. Chairman, it seems like a lot of people leaving since I got here. I don't know what's going on. Thank y'all. Appreciate y'all's service.
All right. Without objection, this item will also remain on the presentation agenda. All right, moving along to our consent agenda. First item on the consent agenda comes from the Board of Commissioners, proclamation for Social Worker Appreciation Month. This will be presented by our Commissioner Brian Barrier. Any questions on this item? Any presentation today? All right, seeing here none, this item will remain on the consent agenda. Thank you very much. Item number 2 comes from the Chamber of Commerce, proclamation declaring April 2026 as Burke Impact Group Challenge Month. This will be coming from Tanya Stevenson, President of Burke County Chamber of Commerce. A little bit different, the twist on the what has been totally focused on litter pickup, but this time it'll be broadened just a little bit. There will be some trash in the project, but also broadening this for other opportunity in the community. So we look forward to that also. Without objection, this item will remain on the consent agenda. Item number 3 comes from the clerk, removal of Alan Glines as plat review officer for Burke County. Madam Clerk.
Thank you, Mr. Chairman, members of the board, ladies and gentlemen of the audience. This is a request to adopt a resolution removing Alan Glines from the list of plat review officers due to his retirement.
All right, thank you. Any question on this item? Seeing here none, this item will remain on the consent agenda. Item number 4, Clerk, Adult Care and Nursing Home Community Advisory Committee removal. Madam Clerk.
Thank you, Mr. Chairman. This is a request to remove Kathleen Andrews' name from the roster. She has decided that she has increased family commitments and needs to come off that board, and this is a request to remove her from the roster.
Any question on this item? Seeing here none, this item will remain on the consent agenda. Item number 5, Clerk Advisory Board removal and appointment. Madam Clerk.
Thank you, Mr. Chairman, members of the board. This is a request to remove Keith Bowman's name from the Social Services Advisory Board's roster. He resigned, and to thank him for his service to the community. And we have, at this time, 1 application on file from Mr. Cothran, and this would be to fill seat number 5, which is an at-large seat, to complete a term ending September 30th, 2027.
Thank you, Madam Clerk. Any question on this item? Seeing here none, this item will remain on the consent agenda. Item number 6, also from the clerk, appointments and reappointments to the Recreation Commission. Madam Clerk.
Thank you, Mr. Chairman. This is I think a three-part item. We have some appointments, reappointments, and removals to the Parks and Recreation Commission. And then we also have, the town of Valdez has a seat number 4. And to have a seat, you have to participate in at least 3 or more sporting events, and they have dropped down to 2. So this appointment request also includes a request to remove their representation in accordance with our Code of Ordinance requirement, because they have dropped below the required number of sporting activities. So we would remove Jonathan Carter, Curtis Hildebrand, Jordan Phillips, and LaPortia Cuthbertson, and thank them for their service. We would reappoint Ricky Barnes, seat number 6, appoint Landon Cook, seat number 7, W.A. Young, appoint Katie Greer, seat number 8, reappoint Sarah Ellis, seat number 11, and then we are still hoping to receive an application to represent Mountain View, and if we don't get one, we'll strike that before your regular meeting. We're happy to try to answer any questions you may have.
Any question on this item? All right, so here none, this item will remain on the consent agenda. Item number 7, also coming from the clerk, appointment to the Library Board of Trustees. Madam Clerk.
Thank you, Mr. Chairman. This is a request to appoint Marty Smith to the Library Board of Trustees, seat number 8, from a Hildebrand City resident, to complete the remainder of a term ending December 31st, 2028.
Any question on this item? All right, seeing here none, this item will remain on the consent agenda.
Thank you.
Item number 8 comes from the county manager, approval of budget amendment number 15 for $2,580,000. Mr. Manager.
Thank you, Mr. Chairman. This is budget amendment number 15, is a grant from the Department of Public Instruction for Burke County Public Schools, and it was Hurricane Helene relief dollars that were made available statewide. This is the portion allocated to Burke County Public Schools. They are asking to utilize this for HVAC repairs at Freedom High School. It goes through the core banking system, which is, we are required as the county to draw that down, so the net impact on the county is 0. But looking to budget this so we can draw that down and pass that along to them for those capital improvement needs. Happy to answer any questions.
Thank you, Mr. Manager. Any questions on this item? Seeing here none, this item will remain on the consent agenda. Item number 9, also from the county manager, approval of budget amendment number 16, $14,277.
Thank you, Mr. Chairman. The request to budget $14,277 of state DHHS grant and our Department of Social Services. There are no local match requirements. This is emergency placement funds, which again are made available at state level and drawdown base. We did not include those in the original budget, so the request is to budget those to help offset foster care costs. Happy to answer any questions.
Thank you, sir. Any questions on this item? Seeing here none, this item will remain on the consent agenda. Item number 10, also from the county manager, approval of budget amendment number 17. Mr. Manager.
Yes, sir. This request is to budget $26,760 also from North Carolina Department of Health and Human Services into our DSS department for family reunification costs. No county funds are required, and similarly, this is a pot of money that was not included in the original budget, as we didn't know the exact amount. So asking for the board to consider allocating or appropriating this budget amendment for these grant dollars.
Thank you, Mr. Manager. Any question on this item? Right, seeing here none, this item will remain on consent agenda. Item number 11, also from the manager, approval of budget amendment number 18.
Thank you, sir. This will be in our senior services department. This is a senior center grant from the U.S. Department of Health and Human Services for $5,600, and this will be used for contracted services for shredding. Obviously, a lot of very sensitive personal identifying information, many of the documents there. And this is, again, a federal grant, no local match, and to ensure document integrity that's being disposed of. Happy to answer any questions you may have.
Thanks, sir. Any question on this item? Seeing here none, this item will remain on consent agenda. Item number 12, also from the manager, budget amendment number 19.
This is an annual request, $36,550 from the Library Foundation. As the board's aware, they are a critical component of our library's operational budget, and annually they contribute significantly, typically more than 50% of the activities budgets that our library staff are able to utilize. So just asking to receive that donation and allocate those funds for the activity lines in the library budget. No local match required here either.
All right, thank you, Mr. Manager. Any question on this item? Seeing here none, this item will remain on the consent agenda. This brings us to our items for decision this afternoon. I have several items for decision. First one comes from the clerk, removal and appointments to the Veterans Service Board. Madam Clerk.
Thank you, Mr. Chairman, members of the board, ladies and gentlemen of the audience. This is a request to remove Curtis Hildebrand's name from the roster and thank him for his service and to make an appointment to fill his vacancy for seat 5, which has a term ending September 30th, 2026, and is a 3-year term.
Thank you, Madam Clerk, and we have numerous applications for that. I think we have some others also coming in as well, so I think our service officer will be checking those out to be sure everybody is eligible, and we'll have a decision to make on that item. Any question on this item? Seeing here none, this item will remain on the items for decision. Item number 2 from our county manager, appointment of members to the 2026 Spring Citizen Academy. Mr. Manager.
Yes, Mr. Chairman. The board at your February meeting opened the application portal for our Spring Citizens Academy, which is scheduled to start on April 9th. So we'll be presenting those applicants to you in 2 weeks at your regular meeting to request putting those folks on the roster so that we can get that started. We have 6. We are prepared to host up to 20. There may be others coming, 7 now. Certainly want to encourage folks that are interested to apply. That application is online. The application portal remains open. So optimistic that we'll fill that class up and ask you guys to make those appointments in 2 weeks.
All right, thank you, Mr. Manager. Any question on this item? Seeing here none, this item will remain on the decision agenda. Item number 3 comes from tax collection for a period ending February 28th. Comes from our tax department. Any report from John? There's John. Yeah.
Thank you, Mr. Chairman, members of the board. We will have the figures for that at the regular meeting in 2 weeks.
Any question on this item? All right, seeing here none, this item will remain on the decision agenda. Also from Mr. Bridgers, our tax release refund report. Mr. Bridgers.
Likewise, we'll have that in 2 weeks.
Any questions on this item? Seeing here none, this item will remain on the decision agenda. Item number 5, also from the tax department, order to advertise 2025 delinquent real property taxes. John?
This is, we're required by law to advertise the delinquent 2025 taxes, and this is you ordering the tax office to do this.
Any question on this item? Seeing here none, this item will remain on the decision agenda. And then finally, item number 6 comes from finance. Application for public school building repair and renovation funds. Ms. Martin.
Renovation funds that are sent to us through the state.
All right, thank you, Margaret. Any question on this item? Seeing here none, this item will remain on the decision agenda. Thank you, Margaret. All right, item number 7, reports and comments. Mr. Manager, presentation of the 25-26 mid-year report.
Yes, sir, thank you. Commissioners have in front of you a draft copy of the mid-year report. That would be county operations, financial performance, and other operational key indicators from July through December of 2025. That is at your dais for your review. Happy to answer any questions you guys may have about that, but I'll be prepared in 2 weeks to present a more executive summary presentation of our performance, which has been really, really strong in the first half of this year. But certainly happy to answer any questions the board may have about this item.
Thank you, Mr. Manager. All right, this brings us to other items for discussion. I have just a few items, reminders. Is this ready for announcement? Okay, all right. Would remind you, gentlemen, if you have any information or reports for the clerk that you need to get to her, please do so she can get those in our package for our regular meeting. Would remind everyone, March 3rd is the primary election day. Polls close tomorrow at 7:30, and would encourage you to get out and vote if you haven't already done so. March the 5th, Board of Commissioners Budget and Strategic Planning Workshop. This will begin at 9 a.m. at Western Piedmont Community College in the Helmick Seminar Room. So just remember that. And gentlemen, if you need to have any breakfast, that'll be ahead of time. So just remember that if you need that. March the 12th is also the Cattlemen's annual meeting that we have been invited to at 6:30. Would remind you of that if you need to RSVP to that meeting, I believe. March 16th, our regular meeting at 6 p.m. And then March the 27th, we're looking forward to another ribbon cutting over at our new Animal Resources Center. So please join us for that, 2 p.m. in the afternoon on March 27th. What day is that? Is that a Friday, Madam Clerk? Yes, Friday. March the 27th. And then Mr. Manager just spoke of our Spring Citizen Academy. Again, remind you, if you haven't applied for that, you'd be interested in learning more about our county government and what is going on in Burke County, please sign up for that. Again, we'd ask youth groups interested in leading in our Pledge of Allegiance to please let us know. And we'd love to have you come and lead our regular meeting with the Pledge of Allegiance, and as well as those faith leaders in our community who might be willing to come and open our meeting in prayer. We'd love for you to do that. Just contact the board clerk, and she will assist you with that. So, and would also remind you to be in remembrance of our United States military and servicemen and women who are currently involved in the Iranian conflict, and those families who've lost loved ones. Continue to remember those in your prayers. With that, we'll move on to action items number 9. I have several items to act on today, gentlemen. First item comes from DSS, our departmental update for the period ending January 31, 2026. We'll recognize Corey Fishwell and our director for that report. Good afternoon, Corey.
Good afternoon.
All right, well, maybe. No.
One more. All right, we'll start off with just an update on our personnel. As of the creation of this report, we had 14 positions open, which represents about a 7% vacancy rate, which is where we've been for the last several months. I think we've talked several times. I think our turnover has definitely stabilized in a lot of ways. We're continuing to, we mentioned before, have a little bit more openings in our IMC positions than we have historically seen, but I think, there's a number of reasons, mostly related to just with some of the changes in the work in that area, and then also, CPS, we have about 4 or 5 positions. We're continuing to work to be creative. I believe April Reese from the HR department is attending a job fair at Appalachian State this week. So we're trying to create relationships with all the area social work programs and trying to make sure we're continue to work to recruit those positions. I do think we've been in a little bit of a lull in terms of applicants, but I will say, I think without question for the last 5 or 6 months, definitely the quality of applications has been stronger, so we have been able to hire people who are coming in with a little bit more experience and can sort of jump in quicker and help us with the work. And in terms of January, we did have 8 separations during that month and 5 hirings as well. All 5 of those were full-time positions. There we go. In terms of our operation updates, we talk about this every month. I just always think it's important to point out that our economic services staff continues to meet all their MOU measures throughout the month. In terms of Medicaid, you can see our total numbers continue to be pretty stable. We have I think it's the second month in a row, did see over 500 applications taken. It's a little bit more than normal, but not a crazy high number. Continuing to meet the timeless same in food nutrition. 500 applications, which is about on par with what we normally get a month, and then you can see our numbers there. We continue to be timely in all of our certifications in FNS. In terms of our adult services updates, for the month of January, we did receive 20 reports. 12 of those were screened in, meeting the definition of needing further service, and then there's a breakdown of sort of how those reports were staffed throughout the agency. We do have 67 awards that we're continuing to be the guardian for, with another 17 that are being managed by a third party. Our special assistant at-home numbers continue to be fairly high, but also stable at about 56 cases a month. And then also, we mentioned before, CAP is an economic driver for adult services, so we try to keep those positions full. We're serving 133 people with the capacity to serve 188, and the state controls the referrals, and we bug the state every day to keep sending them to us, because we have the capacity to meet our full quota of 188. In terms of our CPS report, you can see there, this is pretty typical with the, as the months go. In December and January, you do see a decrease. Usually August, September, your highest month, because that's when school starts. So you continue to see a downward trend. And as for 220, so that was when this report was created, we had 44 screen-ins for the month of February. And then in terms of caseloads, another good sign is the graph is also going down. We had a high of 306 in February of 2025, and then as of 220 as well, we had 233. So I think there's a lot of factors that go into that. We've been able to hire some external support to help us, but also I think, we're retaining staff and also being able to hire more experienced staff who I think are helping us work through some of those. And then in terms of foster care, at the time that this report was created, we had 197 kids in care. During that month, we had 9 new entries and 4 exits from foster care, but I did want to make mention of sort of the volatility of child welfare. So the week before last, we filed 8 non-secure petitions in 1 week. So a non-secure petition means a child is sort of needs to imminently be removed from their home. So there's no other safety provider, there's no other ways to really mitigate the safety other than to file a petition with the court and remove the child. So 8 petitions in 1 week is definitely the most that's ever experienced. In my time here, I mean, there's a lot of factors, that sort of line up to make that happen. But I think what I wanted to point out is like the impact that has on all of our child welfare. Typically, when a CPS worker files a non-secure, we take them off rotation for 3 or 4 days so they don't get new cases, because there's a lot of paperwork and court reports and stuff you have to catch up. But that's assuming like we maybe file 1 a week. So when you file 8 in a week, you can't take 8 people out of rotation. So you certainly create a lot of extra work, a lot of long nights. It's incredibly taxing on our legal staff. Non-secures have to be heard within 7 days, so it's taxing on the court scheduling. And then also, we've talked a lot of times about foster care placement is also a challenge. So trying to find placements for 8 kids in 1 week is challenging, and that often leads, and certainly in this case led to children being in our office for a period of time. So just wanted to kind of point that out, just sort of things you can't predict that impact the workload of the social workers, and sort of what you know, this was 2 weeks ago, but they're certainly still feeling the impacts, you know, 2 weeks later, so. And that sort of also brings into, Commissioner Barrier mentioned the Social Work Appreciation Month. March is Social Work Appreciation Month, so we have a number of things we're working on and planning for staff throughout the month to try to show our appreciation for the work they do every day. And that is all I have, and I'm happy to answer any questions you guys might have.
Thank you, Corey. Any questions for Corey on his report today?
Mr. Chairman, I have a question. Corey, I believe in the new place, if I'm not mistaken, we're gonna have, I mean, we don't want the kids staying out in the offices like we've had because of our situation and stuff, but I think there's gonna be some spacing for that kind of thing, but is this a trend? It's like, I mean, you know, I mean, are we gonna have enough? And
I think it's a double-edged sword. I think we try not to advertise that the kids have to sleep in our building, and we don't want to turn our building into a group home. So we do have a space that's comfortable for the kids, and they have a bed, and there's, you know, General Services was able to build us a shower a couple years ago, and we have laundry facilities. So we do have, I mean, there's no way to create normalcy really inside of an office setting, but we try to create as much normalcy as we can. So we do have a space, and that certainly trying to create, it's a shared space, like it's a visitation room, and the same would be the case in the new build, that we would have a visitation room with the ability to sort of utilize also in these cases if they were needed.
thank you.
Corey, those 8 that were taken in a week, are you familiar enough? I mean, do you feel like a pretty high percentage of those were substance abuse issues?
I mean, for sure. I mean, I can say that unequivocally that substance use was involved in all the cases, I'm sure. I mean, again, like, it's not always the reason why we get involved, but it always becomes a factor in the case, for sure.
Were those multiple families, Corey, do you know?
So those are all individual petitions, so 8 different families, but they were all single kids. So it was 8 kids, 8 petitions, 8 kids. So.
Any other questions? All right, gentlemen, I'll entertain a motion to accept this report as presented.
Mr. Chairman, I make a motion to accept the report as presented.
Thank you, Mr. Barry. All those in favor signify by the uplifted hand. 5-0, Madam Clerk.
Thank you, guys.
Thank you, Corey. This brings us to our Health Department report, quarterly report for the period ending December 31, 2025. This will be presented by our Health Director, Mr. Scalise. Afternoon, Danny.
Good afternoon. Me either, is it? Somebody gonna turn it for me back there? Okay, I guess so. We had a pretty good quarter, that quarter. We're talking about the second quarter of our fiscal year, which ended December 31st. Here you can see our health education team. They're back here in the audience with us. They are about as trained up in a public information officer as we can get, on top of the things that they do normally, including things like hygiene lessons. You can see them at one of the fairs that are there. We realized that at Tropical Storm Helene that having PIO training is probably going to be something that's imperative, and they've been on top of things that are there. Environmental health, I'm really proud of the team in environmental health. If you don't know, we've worked with NC State to get some training for the, thanks Scott, to get some training for everybody on using lean principles. We're now down to 3 weeks and change on terms of our on-site times, which was 10 to 12 weeks not too long ago. And we did all that doing process improvement. You can see that, does it work now? Thanks, Scott. You can see the numbers that we had taken care of there. For the first time since 2009, we'll be, I think it's 2009, we'll be at well over 100% of what we're supposed to do in terms of food and lodging. We'll have a little bit left over. We're well ahead of schedule, and we'll have had pretty close to a record number of on-site permits. Clinic and lab services, one thing that's not, I'll go ahead and address real quick, is not in this quarter, but is happening now. We did report our first case of measles. While I'm here, if you all have questions about that, I can answer that. Disease nurse who got the ERRN, the Enhanced Role Registered Nurse. There are sexually transmitted infection investigations and clinical visits they can do with patients now. Most of the time when we have an audit, it goes very fast, and the state auditors usually look for something pretty big. You can see we had full compliance there, same with the TB program. During the quarter, we had not quite 1,200 patients that came through. Care management, referrals have declined a little bit in that, but overall visits have started to go up, and I'm not entirely sure why that is. It's seen that across the state with this. They say it's attributed to the transition of foster care children to the different PHP providers, but I think we're going to watch that and see if that's really the case that's there. WIC continues to be one of the best WIC programs in the state. We've had stable operations even though we had the government shutdown. I appreciate that the rest of the county helped us find ways to work our way through that because the only program that was affected from us was from the USDA, and that was WIC. There were a lot of young moms and babies that might not have gotten nutrition had we not done what we did, and we kept it together. I felt like we held it together with duct tape and baling wire, but sometimes that's what you got to do. Leadership and staff development. Ashley Jarrett and Miranda, who are both in the audience with me, gave their first presentations at a national conference on case studies that we had here. I was fortunate enough to receive the Roma Prize, which is one of the more prestigious things that our profession can have in this country. And I'm going to embarrass her just a little bit, but Ashley Jarrett is now Dr. Ashley Jarrett. In this period, she finished her doctorate. Yeah, that's worth a clap. She's going to say nasty things to me later on after this. And we did strengthen the community engagement, workforce development by having a fall community health fair. We did host some training for the staff. A couple times a year, we close down and have all the staff come together for training. There are a number of things that we're required to do by the state, so we try to compress those down together and add in some things like leadership training to go in with that. Continuous improvement, data-informed decision-making, and demonstrate sound fiscal stewardship. We've not gone over budget since I've been here, something I'm quite proud of. And with that, I wanted to, since this is the last time that I'll get to present to you guys, take a little privilege, if you all don't mind, and just talk about the team that we have here. I hope you know that comparatively we're, and I would argue this to anybody, one of the best in the state. There are only 2 local health departments in the state of North Carolina that have FAB accreditation. We got ours reaccredited this year. We also got North Carolina local health department reaccredited in the year previously. Out of 89, there's only 2 that do that, and we're much smaller than Cabarrus County. In 2024, we were the Health Department of the Year, 2030, or a Healthy People 2030 champion. We got an award from a group called Select 2000 that I wasn't even familiar with. We were the inaugural cohort of the NC Strategic Scholars Program, which has people from all health departments across the state can get involved with. It's a leadership training. The mental health community collaborative that's going on, and our vital records is regular. The county rates us as to our speed and our effectiveness. And we're regularly in the top 10. The last time I think we had fallen to like number 8. So when families have a death, the death certificate, if you've ever had to go through that process, you have to have that before you can move into some of the business things that you need to do. We're one of the fastest in the state, and we're exceptionally accurate. Health education has implemented NC Care 360. The child fatality review team, which I think Commissioner Berry used it on, that was something that got redone by the state that changed the way that we did everything. We have changed the way that we do the community health assessment. Ours is aligned with a lot of other counties here in Western North Carolina, and Dogwood Health Trust kind of supports us for that. In terms of preparedness, we went through in my time Tropical Storm Helene as well as Winter Storm Fern. And we've done some fun things, but those 2 weren't quite that fun. All of our nurses have the public health nursing credential. We were one of the first when that came out, the new credentialing program. Some of ours were one of the first to get that. Our vaccination initiative has 725 citizens with 1,952 vaccination. We had I don't know what the year was, but it's more than that over my entire time here. But there are hundreds of babies that have been born because of the clinic that we have there. Vaccines for children is usually no compliance issues problems with them. Our WIC department was of the 62 that are given out, we were one of the 62 in the country. There were about 1,800 of them that got the gold award. We regularly take care of our entire caseload, and they're worth a few million each year in terms of that economic impact, because those people take the things that they do and they use them to purchase things in Burke County. Our environmental health team, on top of taking that from a max of 14 weeks to 3 weeks, they received an award from the National Association of Counties for some of the work they did with our team here. We started using GPS, so back in the day, our permits, if you've ever seen them, was on a piece of paper, and someone would say, go to the oak tree and take 3 steps to the right. We now use GPS to be able to do that, and are using ground penetrating radar. When we get through, it's going to take some time to get through this. We'll be able to tell you within a few inches where every septic system in the county is. Well, the ones that are permitted anyway. I'm sure there's a few that were happened before that. Before Dr. Varnado, or Dr. Samuels, pardon me, took over, we did a lot with substance use disorder. I think a lot of the work that we did spilled over into other public health things. The hepatitis A outbreak from 2021 is probably the one that I'm the most proud of. In terms of staff accolades, I'm not going to read all these to you, but our staff are nationally recognized in a number of things. Some of them are leadership programs like Jackson was in. Jackson was accepted into a very competitive regional leadership program at Emory University. You can go through the number of people who've received certifications to make themselves stronger. Lisa Huffman finishes her MBA in 8 days, so I'm very proud of her. We have a number of those that are the non-traditional students who are getting the graduate degrees. Ashley, yes. Ashley earned her doctorate. She was also elected to the North Carolina Institute of Medicine membership. Before I came, no one was involved with that group. There are 200 members, and it is the who's who of health policy in the state. And we now have 4 members in Burke County, including Ashley. Also, Governor Stein appointed her to the North Carolina Interagency Council for Homeless Programs. You can see a lot of the other things that are there in terms of our accolades, and I just want to say that it has been the honor of my career to be here and be the public health official in Burke County. A number of the people have taken me in as though I was one of their own, even though my accent wasn't exactly Southern. I've enjoyed my time here. I believe the team we have here is as good as any in the state, maybe as good as any in the country. We are more bad news bears than New York Yankees. We've done things on a shoestring budget because Burke County isn't Mecklenburg County. But on a regular basis, Mecklenburg County and Durham County have asked us for advice on things, as well as the state. So I'm very proud of the work that's been done here. I'm proud of the team that's here. And I think that whoever comes in, Rebecca did not leave me an empty cupboard. I think I've made it better. I've left this a little better place than when I found it. And I believe whoever comes after me will have all the tools necessary to be able to do that. So I wish you well in your search for that person, and thank you for your time.
Thank you, Danny. Good report. Appreciate all the great work you've done while you've been here with us. Any questions for Danny this afternoon? All right, we look forward to celebrating with you a little bit later in the month. And so with that, gentlemen, I'll entertain a motion to accept this report as presented.
Motion to accept as presented, Mr. Chairman.
Thank you, Mr. Burns. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. Next item comes from our county manager, request to approve property purchase contracts with Partner Health Management and Project Ordinance, facility-based crisis center. Mr. Manager.
Thank you, Mr. Chairman. Appreciate the board considering taking action on this item today. I'll move through quickly, but in February 2025, the board took action to create a standalone. You really prioritized when Corey was a moment ago talking about foster care and the number of impacted families and substance use. It also impacts our detention facility. There's so many really indicators across our community. We continue to be very high in the state in ER visits, opioid deaths coming through our community. Just the sheer number of overdoses, I think harm reduction's impacted that tremendously. We've seen a tremendous amount of activity, I think, in the last 13, 14 months. And today's request is to take another step towards really completing the full ecosystem for recovery because we think that there's a tremendous value in a variety of sectors, including workforce, economic development, and a variety of other areas of what I would consider emphasis. To be very clear, when you look at the board's strategic plan, you've prioritized this effective use of opioid settlement dollars, but really measuring that and what I would consider three individual pillars. Number one, let's save lives. Let's reduce the number of people that are overdosing and dying. Number two, and I'm kind of working downstream for those folks who want to be in recovery, who are ready to be in recovery. What is that pathway? What does that ecosystem look like? And I think that the ultimate goal, the most practical goal is let's try to put preventative measures in place to that hopefully decrease the number of folks that are reliant. And so from back in February, I think it was Valentine's Day of 2025, when the board took action to centralize that function and recruit a standalone staff, and we're going to have a real much more of a data deep dive at Thursday at your work session to look at the BEAR team, the post-overdose response team, some of the providers that have come through RFA. And so I think that we can connect some more dots and see some more of the interconnectivity of what we're trying to build and how it all works together. But this is a slide that we used back in February of 2025, and I think we've slowly built these things together. And today I wanted to talk about a grant opportunity that we have the potential of leveraging with Partners Behavioral Health. Partners Behavioral Health is our LME MCO appointed by the state. And we have secured a $6.5 million grant. We'd like to ask the board to consider using that part of that grant to acquire this property located at 722 East Union. It's a little over 2.2 acres of land. The zoning is appropriate, and we envision this being just another asset in the recovery system that has components of a behavioral health, urgent care, and a crisis detox. The building's about 6,500 square foot as it exists. We envision using the remainder of the grant for rehabbing the existing square footage, but also adding additional square footage. Again, we'll talk about this in more detail on Thursday. The purchase price is $865,000. That's about $133 per square foot. And ultimately, there's not an asset like this really in our region. This is for Burke County folks. It'll be located here, but the idea is that similarly as we've talked, whether it's encounters with law enforcement, emergency room visits, or someone just consulting with a family member, there's not a clear point of entry into the system. As you begin to survey the system, and I tip my cap to the Board of Commissioners for the 5 or 6 strategies that you put in place in the last 13 months utilizing opioid settlement dollars, but things like intensive outpatient counseling and family-centered treatment recovery through Spark, and some of those things that just didn't exist even 6 months ago in Burke County. This facility could act as a stabilization arm and then a triage referral into some of those other available systems for recovery. So next step in the right direction. We really don't have anything that looks like this. This isn't something that Burke County would ever run. We would leverage the grant dollars to acquire and facilitate the asset, but it will ultimately be privately ran and sustained through billings and those type of things, and not something that government will be involved in long term. Again, dive more into the clinical programmatic side at your work session on Thursday. But today's conversation request is to do really 3 things. We have to consider the real property acquisition, consider the grant opportunity. By the way, there is no local match. This is $6.5 million specifically for this purpose in Burke County. And then if you approve, to support or change or deny the project ordinance that would facilitate its development. Happy to answer any questions you may have. I know I went through that fairly quickly. Mr. Chairman, happy to answer any questions.
Thank you, Mr. Manager. Any questions on this item, gentlemen? All right, gentlemen, we have several motions to consider for this item. I'll entertain the first motion.
Mr. Chairman, I'll make a motion to approve the purchase of real property, read number 6606, located at 722 East Union Street in Morganton, for use as a facility-based treatment center in the amount of $870,000. Authorize the chairman, county manager, and finance director to execute closing documentation on behalf of the board.
Thank you, Mr. Bell. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. I'll entertain a second motion.
Mr. Chairman, I make a motion to approve contracts between Partners Health Management and Burke County totaling $6,503,541 as presented, and authorize the county manager to execute the contracts on behalf of the board.
Thank you, Commissioner Burns. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. And then the last motion.
Mr. Chairman, I'll make a motion to adopt capital project budget ordinance number 2026-03 in the amount of $6,503,541.
Thank you, Commissioner Stroud. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. All right, and then one other announcement I failed to make just a moment ago when I was looking at announcements. I would make you aware of retirement celebration we have planned for Madam Clerk on March the 31st. That is a Tuesday from 4 to 6 p.m. We would invite you to come and celebrate with Kay this happy occasion. So we'll look forward to that on March 31st at the Community House here in Morganton. So just be reminded of that. All right, this brings us to item number 10, closed session. Gentlemen, we do have a need for a closed session period today, and I would entertain a motion for that.
Mr. Chairman, I make a motion we go into closed session to prevent the disclosure of information that is privileged or confidential, to discuss threatened or pending litigation, to preserve the attorney-client privilege, to discuss economic development matters, to discuss contractual matters, land acquisition, and to discuss personnel matters as authorized by North Carolina General Statute 143-318.11A1, 3, 4, 5, and 6.
Thank you, Commissioner Burns. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. We'll move into closed session at this time. Again, ladies and gentlemen, thank you for being here today. Thank you for your reports, and thank you for all you do every day.